Assalamu alaikum class. We are going to discuss today the mortality indicators which are related to child health. The learning outcome of today's lecture are that we will be discussing that what are worldwide indicators which reflect the situation of health of the children. Then what are the Pakistan's indicator and where Pakistan stands when we talk about the health status of the children. What are important mortality indicators which we can measure and they reflect the health situation of a country. And then in mortality indicators we have to measure and we have to count the number of stillbirths. We have to calculate perinatal mortality rate, neonatal mortality rate, post-neonatal mortality rate, infant mortality rate, and under 5 mortality rate. So these are important mortality indicators which reflect the situation of healthcare service provision towards children in a community. When we talk about global indicators, as you can see that almost 10.6 million annual deaths of children occur, and these children are under 5 years of age globally, annually, worldwide. Out of these 10.6 million deaths, 70% occur in the first year of life. So this is the most sensitive time period in which majority of the children even die before reaching their first birthday of their life. Out of these 10.6 million annual deaths, 40% occur in the first month of life. So when we talk about the infant mortality, the most important period is the first month of life because 40% of deaths occur in that time period, which indicates that if proper maternal healthcare services are provided to the mothers and proper neonatal healthcare services are provided to the newborn babies, we can reduce this 40% rate to decrease the impact on the infant mortality rate. Let's move towards this chart, which indicates the statistics of 2013. And these statistics have not yet changed. It shows that majority of the deaths of children under 5 years of age occur in developing region, and the majority of the deaths occur in the African region and in the Southeast Asian region, and very less mortality is reported in developed regions. Again, it reflects the poor healthcare service provision to the maternal health and to the child health in developing areas, and better healthcare services, better MCH services, and better reproductive healthcare services are targeted in the developed region. When we move towards the other statistics, it indicates that WHO says that 70% of all under 5 deaths, when we take them into account, 42% of them occur in the African region. As you can see in this pie chart, that almost 50% or 45% of the mortalities are reported in the African region, which is actually least developed area. And then after the African region, 29% of the deaths are reported in the Southeast Asian region. If we target better maternal and child healthcare services in the African region and in the Southeast Asian region, then we can reduce the child mortality by 3/4 of the total. When we talk about the death rates in different countries, 50% of all the deaths which occur globally are targeted mostly in these 6 countries. And you can see that Pakistan lies in these countries where we have a higher infant mortality rate and high under 5 mortality rate. And the statistics of Ethiopia and Congo are even very close to Pakistan. So this shows that the maternal and the child healthcare service provision in Pakistan is inadequate, and the government needs to target much more focused attention should be given to these services, and better healthcare services should be provided by training the LHVs, LHWs, by training the vaccinators, by training the medical officers, and by giving them opportunity to reach the healthcare services at appropriate time with proper referral. When we look at the statistics of Pakistan, UNICEF says that in Pakistan, a baby dies about every 3 minutes. So you can very well imagine the rate of infant mortality and under 5 mortality in Pakistan, that we are losing one baby every 3 minutes. When we compare these values with our neighboring country, which is Nepal, again, a country which has a socio-demographic dynamics similar to Pakistan, but in Nepal, the healthcare service provisions are better. And there, the statistics shows that 3 babies die approximately every 2 hours. So there is a marked difference in the infant mortality rate and the under 5 mortality rate, even in the two countries which have the same socio-demographic characteristics. Pakistan Demographic Health Survey of 2017 and 2018 shows that these deaths are showing the pattern of reduction. As you can see that initially when we compare it with the Pakistan Demographic Health Survey, which was held in early 90s, you can see that there is a reduction in the neonatal mortality, there is a great reduction in infant mortality, and a marked reduction in under 5 mortality. But still, much focus should be targeted towards this region where there is no major difference has been reported in the neonatal mortality. In the early 1990s, the mortality rates were 49 deaths per thousand live births, and today in 2017 and 2018, the neonatal mortality rate is 42 per thousand live births. So this is the area where we should focus, and the neonatal mortality can be reduced by providing appropriate services to the mother during antenatal period, intranatal period, and the postnatal period, and also targeting the neonatal care services as well. So going towards the mortality indicators, which are very, very important indicators, these are divided according to the time of life. And as you can see that all those deaths of children which occur before birth, and they are actually occurring after 28 completed weeks of gestation, are termed as stillbirths. If the death of the baby occurs before the 28 weeks completed weeks of gestation, and this value has been fixed at the value of 24 weeks of gestation, if the fetal death occurs before 24 weeks of gestation, it is known as abortion. And from 28 weeks of gestation up to the birth, if the baby is dead or he's born dead or he's expulsed from the maternal womb, this is labeled as the stillbirth. Moving towards from the birth to 28 days of life, this period is known as neonatal period. And during this time period, the death of the child is labeled as neonatal death. So all the deaths which occur from birth, if there was live birth, from birth up to 28 days of life, this is termed as neonatal death. The neonatal death is divided further into two components, the early neonatal death and late neonatal death. The early neonatal death is the death in early days, which starts from the birth to the seventh day of life. And from 7 days onwards to 28 days of life, this is known as late neonatal death. When we take into consideration the early neonatal death, we must also consider that if we combine the early neonatal death and stillbirths, we can calculate the perinatal mortality rate. Moving forward, the deaths which can occur after the 28 days, which is the completion of the neonatal time period, After the 28 days of life up till the 1 year are known as the post-neonatal deaths. And the major reason of post-neonatal deaths in Pakistan are mostly infections and infectious diseases. The infant mortality rate, which is considered as the most sensitive indicator of a country, which shows that how adequately the needs of the healthcare service provision are addressed, they it starts from birth up to the 1 year. The infant mortality rate, if you want to calculate it, you must consider the early neonatal mortality rate, late neonatal mortality rate, and post neonatal mortality rate, which gives you a true picture for calculation of the infant mortality rate. So these are important indicators, and you must remember these dates because these specific days are importantly used for calculation of these rates and for international comparison as well. So moving forward, if you see that what is the percentage of under 5 mortality when we compare it with the earlier neonatal period, if 100% deaths we divide them into different time zones, we can see that 20% of deaths occur during the first day of life, and this shows that the services which should be targeted during the intranatal period, which is the most critical time period of delivery, are inappropriate, and they are not catering the proper services, and the inappropriate referral or delay in the transport of the patient or delay in detection of the danger signs or delay in health seeking behavior can end up in high neonatal mortality rate, which can account for 20% deaths in the first day. And as the time progresses, these percentages increases. By third day, it reaches 25% of the deaths. By seventh day, it reaches 37% of the deaths. And by 28th day, it reaches 50% of the deaths. So when we calculate the infant mortality rate, we must know that 50% of the deaths, or 48 to 50% of the deaths, occur in the neonatal period, which is the most sensitive period, the period between birth to 28 days of life are really, really sensitive, and we have to target our better healthcare services to this time period. So the WHO divides the causes of infant mortality into the neonatal mortality and the post-neonatal mortality group. And the in the neonatal time period, WHO says that maximum deaths occur because of the prematurity, and the premature births occur because of the inadequate recognition of danger signs, inappropriate antenatal care services, and inadequate referral, which can result in the prematurity of the newborns, and this is the major cause of the neonatal mortality. In addition to the prematurity, we have birth asphyxias, birth traumas, and then we have infections, we have severe congenital malformations. But if we only target the good maternal health care service provision, we can reduce this number. The both things can be adequately addressed if the antenatal services are provided adequately. Moving towards the postnatal period, the post-neonatal period says that majority of the reasons for the death of the children in the post-neonatal period are infectious. And as you can very well imagine, that major cause of death is acute respiratory tract infection, which is ARI. And mostly in general terms, you say that pneumonia is causing deaths of the children in the post-neonatal period. The second major cause is the diarrheal disease. And as you all know that in Pakistan, again, the major cause of children dying or the infant mortality rate are again ARI and diarrheal disease. In Pakistan, 19% of the deaths in the infant mortality rate contributed by the ARI, and 17% of the deaths are contributed by the diarrheal diseases. Other non-communicable diseases include malaria, measles, meningitis, and other communicable and diseases and congenital malformations, which can contribute towards the post-neonatal infections. Again, this picture depicts that the neonatal deaths and the post-neonatal deaths combined, when they are discussed, they cause the infant mortality rate. In neonatal deaths, we have a large number of causes, as you can see, but the most important cause is the prematurity, as you can see, which constitutes 16%. And in the post-neonatal period, the ARI, pneumonias, and diarrheas are a major cause. So, this is just to highlight the major causes which I have already mentioned, that these are the leading causes in Pakistan as well. So when we talk about the under 5 mortality and infant mortality in Pakistan, more than 50% of the deaths are contributed towards the 5 major killers. And these 5 major killers are pneumonias. I have already mentioned that almost 18 to 19% of deaths occur because of the pneumonias and ARIs. 17% of deaths occur because of the diarrhea. And then malaria and measles and malnutrition, 3 M's, are causing another percentage, and these 5 major causes are contributing towards 50% of mortality. And malnutrition actually enters the child into a vicious circle where it exacerbates the presence of measles and malaria and pneumonia and diarrhea, and it reduces the immunity of the child to combat against these infectious diseases. So it's an added contributing factor towards the death of the children. When we talk about the neonatal deaths are majority of the times in Pakistan. Preterm births are a major factor which are contributing towards the early neonatal deaths and late neonatal deaths. Asphyxias and general other infections which can result in bacteremia and sepsis, along with tetanus and congenital malformation. When we target these 5 major killers, we can reduce 75% of the neonatal deaths. The health indicators of Pakistan shows that according to Pakistan Demographic Health Survey, which was conducted in 2017 and 18, and its report has been released in 2019, it shows that Pakistan has the neonatal mortality rate of 42 per thousand live births. It means the total number of deaths of children under 28 days of life. When we talk about the infant mortality rate, we are talking about the deaths of the children up to 1 year of age, and it includes 62 deaths per thousand live births. When we talk about the under 5 mortality rate, it is 74 per thousand live births. So again, by targeting all these areas, we can reduce the number of deaths by proper planning and by proper monitoring and evaluating the healthcare service structure of Pakistan and systems of Pakistan. So moving back towards this, we will be going to discuss the fetal death. As you can see that all the deaths which can occur before 28 weeks of gestation are labeled as fetal deaths, and then from 28 weeks of gestation after the birth, they are labeled as stillbirth. So the fetal deaths prior to complete expulsion of extraction from mother of a product of conception, irrespective of duration of pregnancy, was considered as fetal death. But now the duration of pregnancy is considered very important, and the value of the completed 28 weeks of gestation is the cutoff value. Before the 28 weeks completed 28 weeks of gestation, the death of the fetus is known as fetal death, and after 28 weeks of gestation, it is considered as stillbirth. So there's another term which says, how do you define abortions? Abortion is the expulsion of the product of conception from the maternal womb if it is expelled before the completed 24 weeks of gestation, or if the fetus is weighing less than 500 grams, it is known as abortion. And when we talk about the stillbirths, you can see that the fetus born dead weighing over 1000 gram is labeled as stillbirth, and the gestational period is should be more than 28 weeks to label it as a stillbirth. So the difference between the abortion and the stillbirth should be very clear in your mind. Going towards the stillbirth rate, we can calculate the late fetal deaths, weighing, you can take one parameter. Either it may be the weight of the child, or it can be the completed gestational age of the child. So for calculation of stillbirth rate, the numerator will be late fetal deaths weighing more than 1000 grams at birth during 1 year in a specific community in a specific time period, divided by the total number of live births plus stillbirths weighing more than 1000 grams in the same year into 1000 will give you a stillbirth rate. Remember always, the numerator contains only the stillbirths and the denominator contains the total number of live births plus stillbirths. And in this particular rate, we have targeted the weight of the fetus for calculation. If we do not want to calculate the stillbirth rate with the weight of the baby, then we can calculate it as late fetal deaths for after the completion of the 28 weeks of gestation up till the expected date of delivery during 1 year in that specific time period, divided by the total number of live births and still births weighing more than 1000 gram in the same year will again give us a stillbirth rate. So these are major causes. WHO says that 2.6 million stillbirths occur every year, and every day 7,000 women experience stillbirth, and the major causes are all related to the pregnancy. If pregnancy-induced hypertension is there, preeclampsia, eclampsia is there, premature rupture of membranes is there, multiple pregnancies, cord anomalies, fetal malformations are there, placental malformations are there, they can end up in stillbirth. The global burden of stillbirth shows that 2.65 million third trimester stillbirths occur, and most of them occur in the low income and middle income countries. And you can see that 10 countries account for 66% of the world's stillbirths, and Pakistan is in the list, which reflects the poor healthcare service provision in our country. Moving towards the stillbirths again, you can see that the majority of the brunt is again taken by the sub-Saharan African region and the Southeast Asian region. So the stillbirths have been calculated. Moving towards the perinatal mortality rate, as you can see that perinatal mortality rates includes the stillbirths. Along with stillbirths, it also includes the early neonatal deaths, which are from birth to 7 days. This constitutes the perinatal death. So moving towards the perinatal mortality rate, late fetal deaths from 28 weeks of gestation or more, which is the stillbirths, actually, plus early neonatal deaths during the first week in a specific community in a specific time period, divided by the total number of live births, plus late fetal deaths or stillbirths in the same year, is known as perinatal mortality rate. So remember again, in perinatal mortality rate, the denominators which are included in the numerator are late fetal death and early neonatal deaths. And in the denominator, we include the number of live births and late fetal deaths in the same year. But in certain countries where there are poor services and the poor management of data is there, and we do not have the exact number of late fetal deaths which are occurring in the same year, we use the denominator as the number of live births in the same year, and we can portray it as the perinatal mortality rate. Ideally, the late fetal deaths should be included in the numerator as well as in the denominator. But with poor access to data management, if we calculate it through the number of live births, it again reflects the perinatal mortality rate. Again, the critical time period is 28 weeks to 7 days. The weight of the baby should be more than 1000 grams at birth. 28 completed weeks of gestations are important for calculation of the perinatal mortality rate, and another indicator which is used is known as crown to heel length. It should be more than 35 centimeters to be included as a part of late fetal death in calculation of the perinatal mortality rate. So this is perinatal mortality rate depending upon the weight of the baby. So the late fetal deaths and early neonatal deaths weighing more than 1000 gram divided by the total number of live births weighing more than 1000 gram in the same year into 1000. So it depends that whether you want to take the 28 weeks of gestation in numerator and denominator, or you want to take the weight of the baby who is born for more than 1000 gram to calculate the perinatal mortality rate. You can calculate the perinatal mortality rate by using any one of them. Major causes of perinatal mortality, again, if there is birth asphyxia, if there are low birth weight babies are born, if there is birth trauma, or if the inadequate maternal healthcare services are provided. Moving towards the neonatal death from birth to 28 days, divided into early neonatal and late neonatal. So, neonatal mortality rate is the number of deaths of children under 28 days of age in a year divided by the total number of live births in the same year into 1000 will give the neonatal mortality rate. If you will calculate the number of deaths of children under 7 days of life, it will give you early neonatal mortality rate. And if you will calculate the number of deaths of children between 8 days up to 28 days, it will give you late neonatal mortality rate. So causes of neonatal mortality include again the birth asphyxia, low birth weight babies, preterm babies, sepsis, congenital malformations, etc. Again, the when we compare neonatal mortality rate with early 1990s, we see that the rate is declining, but the decline is not as marked as it should be. So we should focus on the healthcare service provision. So the post-neonatal mortality rate is the number of deaths of children between 28 days of age up to 1 year divided by the total number of live births in the same year into 1000 will give you post-neonatal mortality rate. And when we talk about the post-neonatal mortality rate, major infectious diseases and the environmental factors are important major killers. So the infant mortality rate, the death of the child from day 1 up to the 1 year of age is known as infant mortality rate. The most sensitive indicator, as you can see from birth, it can extend up to 1 year. So the number of deaths of children less than 1 year of age in a year divided by the total number of live births in the same year in the same place into 1000, which will give you infant mortality rate. So after this, 1 to 4 year mortality rate can be calculated, and you can calculate under 5 mortality rate as well. And you can see that when you calculate the 1 to 4 year mortality rate, second year mortality is maximum, and as the age advances, the mortality pattern decreases. Again, the major killers in developing countries are the infectious diseases, and 5 major killers of infant mortality. Infants are the major killers of children under 4 years of mortality. But when you compare it with developed countries, congenital malformations, neoplasms, and accidents are the causes of these children, deaths of these children. So, under 5 mortality rate means the number of deaths of children less than 5 years old in a given year, divided by the total number of live births in the same year. And again, under 5 mortality rate can be calculated by summing up infant mortality rate and the child mortality rate. The child mortality rate extends from 1 year up to 5 years. So, this is the difference between child mortality rate and under 5 mortality rate. So this is the calculation which I want you to submit the assignment within half an hour of the lecture. And it says that in a village with population of 15,000 in a year 2019, the actual number of live births reported were 2,000. In the first 7 days of life, reported deaths were 360, and during 8th day to 28th day of life, reported number of deaths were 120. Reported infant mortality rate of this village is 560. Calculate post-neonatal mortality rate. So please calculate it and submit it within half an hour of the completion of the lecture. Any questions? You are more than welcome. Thank you so much.